You've ever found yourself just staring at, say, cryptic HL7 messages, or maybe struggling to write specifications for an electronic health record, an EHR system, and wondering, what is actually happening with the patient's data? Then you already know the problem I'm talking about.
Right.
And if you're ready to sort of bridge that gap, moving from that confusion to real confidence, well, I'm here to show you how.
That feeling, it's so common, isn't it? Being swamped by the jargon, the complex pathways. What's really interesting is how a seemingly straightforward clinical situation can hide all this IT complexity. Maybe you could walk us through an example.
Absolutely. Let's think about a patient. Let's call her Maria. She's 48, comes into her clinic. She's got some chest discomfort. Seems standard, right?
Typical scenario.
But behind the scenes, from our perspective in healthcare IT, it triggers this immediate cascade. You've got a flood of HL7 messages starting FHIR resources potentially flying around, imaging orders being placed, critical system handoffs happening.
Oh, okay.
You see, data doesn't just move neatly. It travels through this maze, this ecosystem of electronic medical record systems, EMRs, EHRs, health information exchanges, HIES, we call them. And, well, all too often, that data gets stuck. Or worse, it gets misinterpreted.
And that directly impacts patient care, obviously.
Directly impacts Maria's care in this case, yes. It's not just about data going from A to B, it's how it gets there, what happens at each step.
So what's a typical snag we might hit with Maria's data flow?
Okay, well, think about her first clinic visit. Doctor orders an EKG, maybe some lab tests. Right away, that likely triggers an AD2 message. That's for her registration. And then later, you'd expect ORU R01 messages carrying the lab and EKG results back. Now, here's a common issue. The clinic's EHR might be using, say, an older version of HL7, but maybe the external lab she visits for a follow-up test. They might communicate using FHIR, that's FHIR, or maybe even a completely different standard.
Ah, and that's the translation problem, the different languages these systems speak.
Precisely. That's where the headache often starts. HL7, it's the workhorse, often using that pipe-delimited text format, needs really precise field mapping.
Right.
FHIR, though, it's newer, it's API-based, more flexible in some ways, but it needs a whole different integration approach. The key insight isn't just knowing these exist, it's understanding how you actually build the bridges, the translators between them.
Okay.
For Maria's lab results to get back into her EHR smoothly, you have to think about what data is sent, sure, but also how it's structured, how it's coded, maybe using SNOMED for clinical terms, or LOINC for the lab tests and how it's all transported.
And if those mappings are wrong?
If they're off, Maria's results might just disappear.
So the real goal is being able to see that whole picture, from the order to the result actually being useful.
That's exactly the clarity we need. Imagine seeing Maria's entire journey.